are listening to Therapy Plus, a mental health podcast.
The views and opinions expressed by the guest speaker on this episode are solely those of the guest. The content shared is intended for informational purposes only and should not be construed as professional advice or endorsement.
Hi there, I'm Dr. Anna Precht, and in today's episode, I want to give you an overview of dialectical behavior therapy, better known as DBT. I'm a clinical psychologist with nearly 20 years of experience in this work, specializing in helping people with borderline personality disorder, emotion regulation difficulties, and suicidal and self-injurious behaviors. In addition to maintaining a private practice, I'm a senior clinical consultant at McLean Hospital just outside of Boston, and I'm an instructor of psychology in the Harvard Medical School Department of Psychiatry. So let's dive in and talk about DBT, what it is, how it works, and why it's so helpful for people struggling with their emotions and behavior. First, some backstory. DBT was developed by Dr. Marsha Linehan in the 1980s at the University of Washington. Here's part of the story she tells about the creation of the treatment. She was working with people dealing with severe emotion dysregulation, that is, difficulty controlling emotions, suicidal thoughts, and self-harm behaviors. These people would likely fit into the diagnostic criteria for borderline personality disorder. As a quick aside here, I'll note that in 2011, Marsha went public in a New York Times interview about her own struggle with mental health, self-harm, suicide attempts, and hospitalizations. You can read about her story in her autobiography, Building a Life Worth Living. Back to the 80s. She started by using cognitive behavior therapy, CBT, a popular and effective treatment that focuses on changing thoughts as a vehicle for changing emotion and behavior. But her patients often felt like the push for change missed something. They didn't feel understood. Treatment dropout rates were high. So she changed her treatment to focusing on acceptance and understanding instead, validating her patients' difficulties, really listening, and showing compassion, more in line with a humanistic approach. That wasn't helpful either. People liked feeling heard, but they didn't feel like the therapy was helping them solve their problems or change their own behavior. Marsha realized that both would be needed, acceptance and understanding, as well as problem solving and a push for change. So what is DBT? At its core, dialectical behavior therapy is a structured, evidence-based therapy that blends principles of cognitive behavior therapy, CBT, with mindfulness, acceptance, and skills training. Dialectical here means two things that seem opposite can both be true at the same time, and that there are multiple ways to look at a situation. Although there are different ways dialectics are woven into the therapy with therapist strategies and as a skill for patients to strengthen, acceptance and change is the fundamental dialectic that serves as a cornerstone for the treatment. In DBT, we look for the synthesis, the middle path between things that appear to be in conflict. When people get stuck on one side or the other and think in black or white ways, similar to Linehan's initial different approaches, they can miss key parts of a situation. For instance, in ordinary life, I can both be angry at someone and love them. If I'm planted solely on the side of the anger and lose sight of the love, the conflict is likely to get bigger. My emotions are going to get more intense. maybe I'm more likely to say something I'll regret. Flip to the other side, if I negate the anger and only stay on the side of love, I might not ask the other person to change their behavior, which could be important for the relationship. And another example, parents can have rules and they can be flexible. If they are always rigid about rules and never flexible, and I emphasize these as non-dialectical words, they might miss opportunities for their child to grow or learn, or for the relationship to improve. Flipping to the other side, if parents have no rules and are endlessly flexible, well, they have other problems. Woven into DBT are also assumptions and agreements that clinicians make when they approach the work. One is that we assume all clients are doing the best they can at any given moment, based on their history, their context, their difficulties, their skills deficits. Simultaneously, we also assume that people need to do better, work harder, and be more motivated to change. You're doing the best you can, and you gotta work harder and do better. Seemingly in contrast, and both true. So that's a bit of the philosophy. Moving on to the structure of the therapy. DBT is comprised of several modes or components, each of which has its own function and all of which work together to create a comprehensive treatment. I'll introduce each mode briefly and say a bit about what it looks like. The first piece is one-to-one therapy with a trained DBT therapist. During these individual sessions, typically once weekly, the therapist helps the client address specific problems with their emotions and/or behaviors. At the start of treatment, therapist and client create a hierarchy of targets or goals to work on. Clients fill out a DBT diary card between sessions to track behaviors and emotions, and that's reviewed in every session. Diary cards are basically charts, and they help to keep targets clear. They provide assessment of progress, and they facilitate self-monitoring. The agenda for an individual session is based on the diary card and the targets that have been identified. Suicidal, self-harming, or otherwise life-threatening behaviors are addressed first in the session. Anything that's interfering with the therapy on either part of the client or the therapist. For example, if a client missed the last appointment or didn't do practice assignments, or if the therapist maybe got distracted or came late to an appointment, well, that comes next. Everything else that affects the person's quality of life, whether that's relationship issues or substance use behaviors, etc., that comes third. Behavior chain analysis is the tool used to understand behaviors and urges and to figure out what skills are needed. It's basically like putting a problem behavior under a microscope to see what thoughts and emotions and prompts led up to the behavior and what contributes to the behavior getting repeated. So maybe a person engaged in a target behavior during the course of the week. Let's say an instance of binge eating. Therapist and client would look at all the links in the chain that led up to it. Maybe the client got stuck in traffic on the way home, and he ran late to a phone call, and he was anxious about getting things done on time. And then maybe a friend texted to cancel weekend plans. Perhaps then he had all manner of self-judgmental thoughts, leading to an increase in self-hate. And then from there, maybe he spiraled into feeling overwhelmed about work, about relationships, the future, and how he's viewed. And maybe the emotions that got tied into this overwhelming spiral were anxiety, shame, self-hate, sadness, all of which culminated in urges to binge and get relief from feeling overwhelmed. And then he didn't know how to manage the urges, and he engaged in the behavior of binging. He and the therapist would look closely at the thoughts in a microscopic kind of way, and then at the emotions and the various points in the chain where there were opportunities for alternatives, for the chain to go in a different direction by using DBT skills. And then they would come up with a plan for how to practice those skills and make them more accessible in similar situations next time. In addition to DBT individual therapy, clients typically attend a skills training group. Our belief is that if a person is engaging in behaviors such as self-harm as a way to regulate their emotions, it's because they don't know how. They haven't learned how to do it differently, and they need skills. Imagine if no one taught you how to write an essay. No wonder you'd struggle with doing it every time one got assigned in class. The solution isn't to judge or punish the struggle. The solution is to teach the skill. Same with emotions. DBT also assumes that behaviors, even very problematic ones, like shoplifting, substance use, angry outbursts, we assume that those kinds of behaviors serve a purpose, often to regulate emotions. Again, the key step is for people to learn how to regulate their emotions in more effective ways. The skills are taught in a class-like fashion, and homework of skills practice is assigned every week. DBT skills training is comprised of 4 modules. Mindfulness is considered the core skill set in DBT. It focuses on being present in the moment, on purpose, without judgment. This skill set ties into many areas that people struggle with, including their emotions, their relationships, and their sense of self. Distress tolerance skills help people get through crises without making things worse, like some of the behaviors I've mentioned. It's for learning how to tolerate emotional pain instead of reacting impulsively. Emotion regulation skills help people understand and manage their emotions. They're for reducing emotional vulnerability, improving the ability to experience intense feelings, cultivating positive emotions, and changing painful emotions. Interpersonal effectiveness is the module that focuses on relationships and communication. Clients learn how to assert their self-respect effectively, ask for what they want, and observe limits, and how to balance these things with maintaining good relationships. In addition to individual therapy and skills group, DBT therapists provide phone coaching between sessions. If a client is in crisis or facing a difficult situation, they can contact their therapist for real-time support. The therapist might guide the client in using DBT skills to manage the situation. In the client with the episode of binging that I mentioned, for instance, when he started feeling overwhelmed and he noticed the emotions getting more intense, he could call his DBT therapist and say, "I'm feeling flooded. I don't know what to do." And the therapist would say, "How about trying this? How about trying that? Let's think about this other skill." Or maybe later in the chain, when he noticed really strong urges to binge and he didn't know how to not act on the urge, he could call his therapist and they would recommend practicing some skills in the moment to avoid making the problem worse by binging. I think of skills coaching like in sports, where athletes go to practice and learn skills and repeat them and rehearse them. Then, when the big game comes, maybe it's the real crisis of an argument with a loved one, they need coaching to remember what they learned in cooler moments. Coaching helps clients to take the skills they've learned into real-world situations. So for the process of learning, patients acquire the skill in group. They then need to strengthen those skills muscles with practice and support. And then they need to generalize those skills to all the contexts that are relevant. Again, with the support from individual therapy and between session coaching. It's like learning a language, yeah? Start with acquisition, learn the vocabulary, build it up so it's more solid, and then take it to the places where it makes sense in your life. Working with suicidal, self-injurious, and emotionally dysregulated individuals is tough work for therapists too, and they need support to do it effectively. So DBT therapists participate in what's called a consultation team. This group helps therapists stay effective and on track in their treatment, to avoid or take care of burnout, and to ensure they remain compassionate and well supported in their work. If you or someone you love is considering starting DBT, I encourage you to interview therapists to find a good fit for you, and to ask about whether or not they provide all 4 of these modes of treatment. If they don't, it's important to ask why. Numerous studies have shown DBT's effectiveness in treating borderline personality disorder, in reducing suicide attempts and self-harm, decreasing cost of treatment, hospitalizations, and patient dropout, and improving overall quality of life. And research has been done across settings: inpatient, outpatient, residential and day programs, as well as forensic settings. While it was originally developed to treat BPD, it has since been adapted to treat a wide range of psychological conditions. It's been shown to be effective for people with chronic depression and anxiety. There are specific adaptations for treating substance use disorders and eating disorders. DBT is often used to treat PTSD, particularly when symptoms involve difficulties with emotion regulation. Beyond being effective for adults, DBT has been adapted for adolescents and their caregivers. This adaptation includes a family skills training component. We also have an adaptation for younger children called DBTC, and it involves parents much more actively. To wrap up, dialectical behavior therapy is a unique and complex evidence-based approach. It helps people with a host of difficult-to-treat behaviors and diagnoses. By integrating acceptance with the need for change, DBT offers a path forward for individuals who are struggling with intense emotions, self-destructive behaviors, and relational difficulties. I love many things about DBT, including the team-based approach and support of clinicians, the skills that are pragmatic and helpful, as well as the many assumptions and agreements that serve as anchors and that allow for authenticity and flexibility within the treatment. Most of all, of course, I value how well it works and the change I see in people's lives daily. It empowers people to take control of their mental health and build a more fulfilling life. Or, as we say in DBT, a life worth living.